Thank you. That's very, very interesting and very helpful. Dr. Kate, you also had something to say.
Yes,
Please feel free
we're
to
making a list of free AI resources because most of the platforms do have free content. So it doesn't even have to cost anything. And also, as I mentioned, we need to drive these efficiencies because many schools, both public and private, are incredibly inefficient. And just to give an example, we did a study of schools in northern Nigeria and found that many of the schools had dropout rates of 60% or higher, 60 or higher. And the schools, of course, would lose the tuition of those students. So just if they were to solve that dropout problem, they would have the money it would take to buy into these platforms. It really is not a lot of money. We should not be thinking of resources as a constraint here. It's more the political will at the regulatory level and at the school leadership level, because frankly, that's where I've seen it stop. Students are very engaged, they're very interested. FAMSA, the Federation of African Medical Student Associations, is very on board with AI. You have huge champions there. So we shouldn't think from a resource constraint point of view. And I think we should also think from an equity point of view, because higher income students are already buying into these platforms. And so if the schools don't offer the platforms to everyone, you'll see the inequities, between higher income medical students and lower income medical students, grow even more.
And thank you so much for touching on inequality and equity, because that was going to be my next question. And when we see like elite institutions race ahead, how do we make sure that we're not widening the gap and allowing public schools to be left behind?
Yeah, that is the big issue. We work with a lot of schools in procurement because we do group procurement because we can, drive costs lower if, 10 schools are buying software or, rather than one school. But often, unfortunately, the public schools aren't able to participate because they have such difficult procurement rules. And so I do think that ministries of education, ministries of health need to look at procurement to make it easier for the schools to buy this. I think also the schools need to point all students to the free resources. And also we're going to see that the Silicon Savannah step in and I think, create some homegrown resources that have the data sovereignty, that have the regional ethics that perhaps are more suited to African medical schools.
Okay, thank you so very much. Let us now just turn our attention to curriculum reform and faculty readiness. I think we've touched upon it a little bit when we're talking about political will and adoption here. So let's talk about the classroom itself and the people leading it, right? And Dr. Aching had mentioned as well that AI should help free up our lecturers from, I don't want to use the word mundane, but time-consuming but not productive tasks that need to be done. So I'm directing this one at Dr. Aching. In your opinion, given your experience at the Africa Leadership University and how you've pioneered new learning models, if you look at, for instance, Harvard's example of mandatory AI literacy courses for their faculties, how do you think African medical universities can start integrating AI literacy without overwhelming their faculties and or overpacking the curricula?
I like the word that you used, which is to integrate and not necessarily make them feel like it's an added activity. So definitely looking at AI as part of the learning and part of the curricula they already have, and layering it across what you already teach. So for example, if students were to analyze a case, we can simply add a step, meaning after they have the initial steps, then we add test it with AI, now check against guidelines and explain what is wrong. So being intentional about adding it as a step of what we are already doing in our universities, and integrating that initial training of AI fundamentals and understanding that even as we look at ethical training, ethical legal considerations, that we embed the understanding of, if you use AI, these are the essential competencies that you should have, how you should evaluate the analysis of AI data against what you know. and also just the management skills around managing AI. So that I don't think would require a heavy investment initially, but we do need to prioritize, just as Kate has mentioned, we really do need to prioritize the teaching of our trainers and enhancing AI literacy from them and ensuring that our educators are proficient in understanding how to integrate AI into daily teaching practice.
Thank you. Thank you. That's very, very interesting. In your opinion, or in your experience, rather, do you think there will be resistance? I mean, I know that sounds like a bit too trite. Of course, there'll be resistance, but maybe a better question is what is the best way to manage expected resistance? And then just as a part B, do you believe that faculty may see a world where they may be replaced by certain AI taught models? And how do you deal with that change management, or rather help them quell those fears?
Yes, so definitely resistance will be there. Resistance is normal. And one of the approaches that others have used in introducing AI is using a stepwise approach or a phased approach. As I'd mentioned before, starting off with a real pain first and addressing something that they have felt has overwhelmed them, like that grading of assessments or student assessments, etc., is very important. Also giving those clear rules, for example, writing down policies and being clear on what AI can do and what it can't do, and making it public and building trust on that. And then also sharing wins. There can be wins that have happened at administrative level with the use of AI, and sharing those wins and trickling them down to the faculty is very important, as well as between lecturers. So the lecturers who are quick to adopt, we can also use them to be advocates for other lecturers. So when one lecturer uses AI and shows how they saved hours and improved feedback, others will tend to follow.
I like that you say sharing wins, because I want to open this up to Dr. Kate and Dr. Abu, maybe more for Dr. Abu. Would any of you advocate for almost like a Pan-African AI for Health faculty accelerator, where we share, like universities across the continent are sharing learnings, sharing wins and approaches, and disseminating it across to their colleagues, just like Dr. Aching was advocating for just now?
I think we are at the earlier stage. Oh, sorry. You go ahead. Go ahead.
Oh, we already have two continental associations of African medical schools, and so I would use them as that platform for that, rather than creating a new one. And we have existing, systems like the Africa CDC. So I don't think we need a new platform. I think we can use the existing platforms that we have.
That's a good point. That's a good point. Dr. Abu, are you going to add anything else?
Yeah, I think, we are at the earlier stage of adapting this AI in different aspects of the social as well as educational institutions. So the first steps, especially taking into account what is going to happen in the medium and long term, is just, developing that ecosystem where the AI-friendly environment emerges, and students would start to internalize the use of it, and the curriculum would be developed accordingly. And the degree of resistance that might, emerge may actually, get manageable when we have this internalization of the whole process. One element of the whole exercise is, what are we promoting by introducing AI in the educational system? Some countries may prioritize the idea of new technology to really promote the social harmony, the social objective function that includes education. So within that kind of broader scope, internalizing becomes manageable, easier, cost-effective. But actually, one thing that we have to emphasize also in the context of African countries is there is a deficit of attention to education, attention to especially, this tertiary educational activities. So access becomes an important element, and the case of those who are having earlier access would take advantage, and at least in the initial stage, it may worsen the level of inequality in terms of access to these vital services. So that is the type of challenge African societies and Ministry of Education, health, ministries have to address. There is other competing needs in terms of resources, in terms of policy attention, but that has to also take into account emerging technologies like AI. Thank you.
Thank you so much. Thank you so much. Just a quick housekeeping announcement. I see the questions on the chat. We will get to them once we open up the questions to the floor. So thank you for that. I think we can now maybe shift a little bit to the big topic on everybody's mind, right? Ethics, equity, and humanistic care. AI is scaling, yes, and it's a good thing, but then for every 3 or 4 good news we see, we always hear the one bad news. So there are ethical questions that are attached, and I'm going to open this one up to all panelists just to get your thoughts. How do we make sure that the AI systems are not reproducing the existing medical biases that we see today? I mean, for instance, we've heard that dermatology algorithms are trained to diagnose lighter skin tones rather than darker skin tones, and especially in Africa where we have a data paucity, like we're not very rich with data. How do we make sure that we are building AI in from the start, building these ethics into our AI systems from the start?
Shall I
I would
go
like
first?
to
Go ahead, please.
I would like to divide the ethics up into the ethics around teaching and then the ethics around practice. So in the ethics around teaching, we've already touched on the equity issue, that some people might be locked out either because they're priced out or for whatever reasons their school doesn't offer AI education. So that's one issue. Then there's the ethics of practice, and that's where I think the bias comes up, that a lot of the AI is trained on global north data rather than global south data. And really the main solution to that is either to build your own products and platforms, or to ensure that global south data gets into the global platforms that already exist. And we're going to have to work around the African data sovereignty issue, because that sometimes actually blocks the access into the global platforms. But I'm really hoping to see many more products come out of the digital savannah, and products that are trained on African data.
That's interesting. So you're saying it's almost like a world where it's a collaborative effort between the